Hello, and we are back with another episode of the FTM's Guide, and today we are talking about phalloplasty. So the things I'm going to cover today is the procedure or the process of getting phalloplasty, the types of phalloplasty, and the function. So I personally didn't get phalloplasty. I got metoidioplasty, but I looked really extensively and deep into getting phalloplasty, and I am looking to get it in the future. I'll explain that why in another video, but let's get into it. So with phalloplasty, the procedure of getting phalloplasty before you actually get it, you have a little bit of prerequisites. I'm not sure in each different country they have different requirements, but you should take testosterone for minimum at least 2 years. You should be in good weight and health, obviously, because it's a very extensive surgery. It comes in 2 to 3 stages, and you should also really be prepared psychologically. Like I said, the pain and recovery, and some countries do require that you have a psychiatrist's note that you pass for this surgery. Like I said, again, it is a very big and extensive surgery. So usually this surgery can come in 2 or 3 stages. Now the first stage is if you get it on your forearm or if you get it on your thigh, you need to place a tube within your forearm, and then they will cover it with plasters. And the reason you need to put a tube is so that the nerve endings can grow, and it makes a urethra. The same thing with your thigh. You need to put a tube into your thigh. Another place you might need to put a tube in is your shin. This is the fibula procedure. So let me go through what procedures there are. The different places you can get your phalloplasty from your donor skin is your forearm, or it's called radial forearm procedure. You have it on your thigh, the upper part of your thigh. Don't worry, I'll be showing pictures. Is called anterior something, ALT, anterior lateral something. I don't remember the name. You can get it from your lat, so this area of your skin. You can get it from your abdomen, so right above your pubic bone and right under your belly. And you can get it on your fibula, meaning you use the bone on your fibula on your shin to make a penis. So the pros and cons of these procedures. So obviously with the forearm, this is the most common method, is the easiest method as well. Is one, it is probably the most cost-friendly and, like I said, the easiest procedure. The biggest drawback for this one is that you will have a massive scar, and the scar isn't, it's completely obvious. There's no way that you can run away from the scar. And with the fact that you have to take a large chunk of your skin, it's gonna look like your skin is indented. So if you can see some pictures of some scars right there, if you're totally okay with it, that's fine. But another thing is it really affects your ability to, if it does affect your arm's ability to do normal day-to-day things that you usually would have done, it kind of compromises it a bit. There are a lot of videos of guys who talk about this. You can go into detail, but if you're happy with getting it, that's totally fine. So the one on your thigh. In terms of sizing, the forearm makes a medium-sized one. In terms of your thigh, it makes the largest size phallus. And that's pretty much the biggest advantage. Another advantage is it's hidden within your pants, so people don't actually see the scar. And the scarring for the thigh, if you can see, it's still obvious, but it's a little less obvious than your forearm, first of all, because it's on, you're covering it with pants, and sometimes it heals a little bit better. The thing is, with sizing, with the thigh technique, is your phallus, your penis, doesn't naturally shrink and erect. So what size you get is going to be the size in your pants. So I personally wouldn't recommend getting a large size penis, because your penis won't naturally shrink when it's colder. It doesn't naturally shrink or erect. It will just stay that one size. So it's gonna look really, in my opinion, ridiculous in your pants, or it could be, potentially really uncomfortable. So really keep that in mind. The next method is the latissimus dorsi, the back part of your muscle. I actually don't know much about this because I haven't really seen much guys who do this, but a good advantage, like I said, is hidden. You can't really see it. The disadvantage is definitely, your scar here, and with any scar, because you're taking a chunk of skin out, it's going to be indented in a bit. Another one is your fibula, the one on your shin. So that one produces a small size. You actually use the bone in your shin. And the biggest advantage of that one is it has natural rigidity, meaning that you don't need to have the erectile device put in. It will naturally be rigid because you're using your bone to make the phallus. But the only thing is, it is relatively small in compared to all the other procedures. But the biggest disadvantage is because you're using your bone might not heal properly, and you might have issues permanently in terms of walking or even exercising like you used to, because your bone isn't gonna grow back, can potentially not grow back the way it's supposed to grow. So that is part of the first stage, is really where you're choosing the position of your phallus. Oh, I forgot, sorry. The next one is the abdominal one. Is, like I said, you're using right on the bottom of your belly, right on the top of your pubic area. The thing is, the biggest advantage of this one is the scarring. It's gonna be a straight line. So some pictures, it's gonna be a straight line just like that, right under your stomach. So it kind of looks like scarring when people who are overweight have the remaining fat cut off. So that's kind of a good thing, and it's relatively easy to hide, and your skin doesn't get indented. And really, another advantage is you don't need to put the tube in. They can just naturally make it. But the biggest advantage is it's probably the most painful procedure, just because it is right under your pubic area, right on top of your pubic area, right under your abdomen, and it is probably the most risky as well, because right under that area, you really need to be careful. You really need to take care of it really, really well. But it is a very good procedure for the most minimal scarring. So like I said, these are the second stage procedures. Now, you might not get to choose which area you want to do it first stage procedure. I'm not sure if I just said second stage, but like I said, you might not get to choose where you want the donor area to be, depending on the doctor and depending on your health, your skin. You really have to look at it again. But yeah, so with all the first stages done, where you're choosing it, where you have to prepare put the tube in for your urethra. In some cases, for example, the thigh or the arm, if you're really hairy, you need to keep getting laser hair removal permanently so that area is hair free. The second stage is when you actually do it, when you actually get the surgery, get the phallus made. With this, the scariest part about this is what a lot of people don't know is that when you get it made, the scar is going to be open. So there's a lot of dead tissue. It's open and it looks really like gruesome. So it basically looks like it's really thick and sausagey, and it has like big gaps in it because they can't sew it together yet. So you're gonna be in intensive care with the nurses and the doctors, because what they have to do is they have to wait for the internal healing process to occur, to let the swelling go down as much as possible, to let the swollen tissue really heal before they can stitch up like that actual phallus. In some cases, there are doctors who are, it's just completely stitched up, but in a lot of cases, which I know in the place where I personally did my metoidioplasty, is they leave it open first. So it's gonna look like a giant, like big areas of just red and scab, which haven't been sewed shut in. And that part of recovery is tiring. I mean, you could probably imagine how long it's gonna take. In my case, the hospital that I go to is you have to be in the hospital for 3 weeks, 21 days to really take care. And that's not the only process. The thing is, taking care of the wound down there, you need to take care of the donor site as well. And I've heard a lot is that down there doesn't hurt as much yet because it is an attachment. But what hurts is the donor part. Some people complain, and some people don't complain, but they say like how painful the forearm was, how painful the leg was, how painful their donor site was prior to the surgery. So really keep that in mind. The next thing is, once your phallus gets healed and everything, 6 months to 1 year along the line, some doctors do and some doctors don't, is they make the head of the penis. If the doctors don't, then you have to come for another surgery to make the head. If you don't mind not having the head, then that's totally fine. But you know, that's third stage of surgery. Third stage of the surgery obviously is the optional is 1, if you want to make the head, 2, if you want to put a rectal device in, or 3, if you want to have balls, if you want to make your scrotum and you want to have testicles. These are all optional, but it is the third stage of surgery. And really keep in mind that this surgery, phalloplasty, because it's multiple stage, you should expect anywhere between 1.5 to 2 years to get it completely finished, okay? In terms of sensation wise, in terms of function, like I've heard from many people, and like what I've heard is it does take a while for the nerve endings to connect. So probably the first year or so, you're not gonna feel anything. And again, because it doesn't naturally get erect, if you don't get an erectile device, you are just gonna have a flaccid penis all the time. Okay, so really keep in mind before you actually do get phalloplasty, the health complications, the possible complications that can happen. You know, is it something you really want? Is the function something you really want? Obviously, I forgot to say you can stand to pee. That is the purpose of having a phallus. But if you're really considering taking to that surgery, really do extensive research, really search on your doctors, really look at the countries or the type or anything. Like I said, some do 1, 2, 3 stages, some only do 1 and 2 stages. So really keep that into mind. And because I am considering having phalloplasty in the future, I would love to share a video for you guys when I actually do it, but that is very, very long way along the lines, maybe like 5 to 8 years in the future. So if you enjoyed this video, please give it a thumbs up. Please subscribe if you're new for more content like this, and I will see you in the next one.